Hi, my name's Mike Bauerschmidt, and I'm right now president of ACAM, but I was not always involved in functional and integrative medicine. For over 22 years, I was a card-carrying member of the Church of the Medical Orthodoxy. I worked emergency departments, and I loved it. One night, after finishing a night shift and driving home, I was rear-ended on I-95 by a plumbing truck. I blew out 3 discs in my neck and 2 in my lower back. Being a card-carrying member of the Church of the Medical Orthodoxy, I, of course, went to see the neurologist who sent me to the neurosurgeon who sent me to the physiatrist. And by the time everything was said and done, I was sitting at home popping long and short-acting narcotics and muscle relaxants and anti-inflammatories and eventually antidepressants and sleeping pills. And then, of course, you had to have the amphetamine to keep you awake during the day because you're so doped up from all the other medications. In short, my life was not working out well. So they decided that they would do a really low-risk procedure called percutaneous disc decompression, where they just inserted a little needle into the disc. They used a radio wave catheter to fry the gelatinous portion. And of course, nature abhors a vacuum, so the fibrous portion would contract off the nerve and all would be well. And it was for about a week. Then I developed progressive pain in that low back area where they had done the procedure. After about 2 weeks of progressive suffering, they decided that what had happened was I developed an infection in the disc and the bone. So I had discitis and osteomyelitis. This was followed by 6 weeks of IV antibiotics. By the time I was done with this whole regimen, by the way, all the time I was still on all the long and short-acting narcotics and muscle relaxants, et cetera, et cetera. By the time all was said and done, I was a hot mess, as we say in the South. And I wasn't a very happy hot mess. I happened to run into one of the guys I used to work with in the ER who was starting an anti-aging practice. His name was Mark Rosenberg. And he said, "Mike, let me give you some IV vitamin C." And I went, "Mark, I thought you were a doctor." And he said, "I am. What have you got to lose?" Not having a good rebuttal to that one, I rolled up my sleeve. And he proceeded to give me infusions of vitamin C followed by alpha lipoic acid. At the time, I really didn't know much about either one of them, except that after my 3rd infusion, I remember I walked out to my car to open my car door. And as I reached, I realized that that didn't hurt. And not only did that motion not hurt, I wasn't in pain at all. And it was the first time in over 2.5 years that I realized what it was like to be pain-free. And I was dumbfounded because this stuff wasn't supposed to work. This was not standard medical care. So of course, now my curiosity is piqued. I go home, I look this up on the computer, I look up IV vitamin C, and up pops this place called the Reardon Clinic. They say, "Give us $500, come on out, and you can learn what we do." So I spent a week with them. Spent a week with Ron Honeyhockey, and he let me sit in on his interviews with patients, and I got to roam the grounds and talk to people and go through their library, which was it's almost like a public library there with all the references they had. I said, "Okay, there's something else you need to know about." And I said, "What's that?" I said, "Chelation." I went, "What's chelation?" Well, I knew what chelation was, but I thought it was all quackery because there was a patient that I worked with that always was getting chelation in Fort Lauderdale. And about the time he drove from downtown Fort Lauderdale to his home back in Boca, he passed out in front of our ER. And so he'd come in, we'd tank him up with some fluids because we didn't know what else to do, and he'd feel better and send him on his way. And so I was absolutely convinced that this was all hocus pocus. But I said, "Well, where do you learn chelation?" He said, "Well, there's an organization called ACAM. Check it out." So I packed up my bags, I flew back to Fort Lauderdale, and I got back on the computer. I looked up ACAM, and they were having a meeting that fall. And actually from there, the rest is kind of history. I was fascinated by the fact that you could learn to help the body heal itself as opposed to just writing prescriptions to mask symptoms. This idea of being a true healer was so fascinating to me that I kept going to every ACAM meeting I could. Actually, I went to every ACAM meeting they had between the time I joined and the present day. And each time I go, I find something new and different that I can add to my practice to help my patients. I'm much more satisfied in the functional and integrative medicine arena. This work is rewarding, it's powerful, and it's effective. So I can't encourage anybody enough to come on out and join us and learn more about what you really can do to help your patients live better, happier, longer lives. Thanks for listening.